Australian businesswoman and fashion model Elle Macpherson says she's now in clinical remission after being diagnosed with cancer 7 years ago. Macpherson has been sharing her integrative medicine approach, which involves swapping chemotherapy in favour of what she calls an intuitive, heart-led, holistic approach therapy. Dr. Norman Swan from RN's Health Report has the details.
She's saying that she was diagnosed 7 years ago, and I'm going on the Woman's Weekly report of this, but it's what's got major coverage, and that she took advice from a lot of different specialists, and she decided to take lifestyle, holistic care. It's not exactly clear what she did in fine detail, but she refused mainstream medicine and has been effectively untreated apart from removing the lump at the very beginning, and has gone 7 years without a relapse, and so she's in remission. Now, this has been taken to interpret that, well, what she's advocating for is holistic care for cancer. I think, to be fair, she's saying she's not imposing this on other women, it's her choice. And I think before we go on in this discussion, any treatment that a woman might have for breast cancer, or anybody might have for cancer, is their choice. You're presented with a choice, and you can choose whether or not you want it or not, or what extra you might want. Now, there's a history here of celebrities with breast cancer. So Kylie Minogue, maybe about 20 years ago, 19 years ago, that got a lot of publicity, and a lot of people, including young women, came forward with breast symptoms and may well have saved quite a few lives. Olivia Newton-John did great work with breast cancer, and she believed in complementary therapy, by the way, but not at the expense of mainstream therapies. So you've got the Olivia Newton-John Cancer Centre in Melbourne. So again, a major contribution. And it has to be said that many people who've got cancer will take on other therapies. But the question is, are they alternative, which is really what Elle's done, or complementary? You have it alongside, because that's what you mean by complementary. And again, before we go on, this is not to minimise the benefits that anybody can get from lifestyle changes with cancer. The most potent is stopping smoking, but also exercise. So exercise is under-prescribed in cancer care. It actually improves survival and helps prevent cancer and prevent relapse. So exercise is incredibly important. Nutrition is less clear, but may have an influence as well. But this is in addition to mainstream medicine. Now, over the last 30 years, the chances of dying if you've got breast cancer, your chances of dying of it have reduced by 40%. That's a massive reduction. Now, that is not because women are meditating or eating a vegan diet. It's because mainstream medicine has made advances understanding the particularity, the specificity of different kinds of breast cancer and how it's treated according to a woman's age, whether she's had menopause or not, and what the molecules around the tumour are saying. Now, Elle had a type of tumour, according to the report, called ductal carcinoma in situ, and that's where the cancer has not spread, it's not invaded into the tissues around the duct which carries the milk. Now, a percentage of women with this form of early cancer do not progress to invasive cancer, or if they do it very slowly. And I think that Elle's just lucky that she's one of these people with ductal carcinoma in situ where it didn't progress. The trouble is, oncologists, cancer specialists, have no real way of identifying in which women this cancer will progress and which it won't. So they're all offered treatment. And I think that, she's one of the fortunate few where it hasn't progressed, and I hope it never does.
And her approach to her cancer, though, is being seen as problematic. Well,
it's problematic if women abandon mainstream care to do holistic therapy, thinking that's going to cure their cancer. Holistic care is going to help their cancer, but if you want to minimize the chances of your cancer coming back, you would take on mainstream treatment. By the way, mainstream treatment for many women does not require chemotherapy. It may require much gentler forms of therapy.
So what message do you have overall then, out of all of that, for women who are hearing this?
Prevention. You've got to be breast aware. So if you find a lump where you haven't felt one before, come forward for care no matter what your age is, because there are more young women coming forward with breast cancer. Participate in screening. Don't smoke. Don't drink too much alcohol. Know whether or not there's a family history. You've got a family history of breast cancer. And if you're diagnosed with breast cancer, have a serious conversation with your oncologist about the treatment and the assessment of the risks of it coming back versus having the treatment, and make your own mind up.
More on the Health Report on RN and on What's That Rash podcast. Good to see you, Norman. Thank you.
Thanks, Roz.